Hello everyone, my name is Kira. Thank you for joining us today for MEDASTRA's free online smart class about the PLAB 2 exam. I'm very excited to introduce our speaker for today. Dr. Sara Awan is a lead course trainer for MEDASTRA's PLAB 2 course. She has been working in the NHS for the last 15 years and is passionate about teaching and training medical students and junior doctors. She not only enjoys teaching, but ensures her students enjoy learning as well. She has a vast experience in the field, as she has been teaching and mentoring medical student and junior doctors for many years, both at the workplace and informally on a voluntary basis. Her communication skills are excellent, and she has always excelled in both written and practical exams, scoring exceptionally high marks on her interpersonal skills. Dr. Sara Awan is a practicing NHS GP and also has special interest in women's health, dermatology, aesthetics and mental health. We are very lucky to have her here today to talk to you about the PLAB 2 exam, and I will hand over to her now.
Thank you so much for that lovely introduction, Kira. I'm Dr. Awan, and I'm really pleased to be having this first free smart class for all of you who are interested in taking the PLAB 2 exam. I'm very sorry for the kind of delays that the admin team have been experiencing. It's our first smart class, hopefully the first in a line of many, and we will have ironed out all these initial issues. We'll call them teething problems, so hopefully it won't happen again. But thank you so much to all of you for your patience and for joining us today. So we're going to start with just a little bit of an overview about the exam. We do have some people who are joining us who are probably still thinking about taking the PLAB 2, though most of you already know all about it, but I will just quickly try and gloss over. We won't spend too much time on that because I know most of you know about that anyway. So I'm just going to start sharing. Right. I hope everyone can see the screen. Right. Okay. So we're just going to start with, like I said, a brief introduction to the PLAB 2 course, to the PLAB 2 exam. What does PLAB stand for? The Professional and Linguistic Assessment Board. This is an exam which the GMC, or the General Medical Council, hold for any international doctors who wish to come to the UK and practice here. So they need to make sure that you do have the correct skills and the knowledge to practice medicine here. And that's why they have to have this test. The test has two components, obviously. One is the written, or the PLAB 1, as we call it. This checks your knowledge to make sure you have a sound knowledge base for you to be able to practice here. And then PLAB 2, which is what we're here for, is the practical skills component to make sure that you actually have those skills. Having the knowledge is obviously not enough. They need to know that you can put that into practice. So what is the PLAB 2? The PLAB 2 is what we call an OSCE exam. Or an objective structured clinical exam, as the name suggests. It's a practical exam, and it basically challenges you at the level of an FY2 doctor. So imagine you've done your medicine, your medical degree, your first year of FY1, which is your foundation year 1, or abroad, people call it your house job, junior house officer. And then the level that you should be is of an FY2 doctor beginning, and they cover that sort of exposure for you. They are very much based on real life settings. All of the consultations, all of the scenarios that you will get are very much realistic. They are actually not something that, they are something you'd really expect to encounter. So it's actually a very good way of gauging if you are comfortable in those sort of scenarios. You could have various settings. So there could be like a consultation at GP clinic or an emergency case. Again, it's very, very important to remember the PLAB 2, which many people unfortunately forget, is it's not just about testing your knowledge and how much you can speak and how many differentials you know, how much management you can quote. It's about how well you can apply all of that knowledge and actually dealing with real patients. And it's to see your interaction with that patient and how you manage to, go through that entire scenario successfully. So it's really not about just memorizing and remembering things, but it's about you, how good a doctor you are. Um, the exam is very much based on current best practice. So if you're going to dig out, notes from 10 years ago, I would advise throw them away, because you really need to know what things evolve, things change. You need to be very much current. And of course, they are according to the published evidence and guidelines. So when we say not according to local arrangement, it means that sometimes people will, over here we have something, different areas where they have different guidelines for managing certain, specific cases. That's not what they want. We are looking very much at the published evidence, the accepted guidelines, the reliable sources of that we have to depend on, and that's how we should be managing the cases. Now, a little bit about what to kind of how to prepare. So I'm just taking you on the PLAB2 journey, really. So before the exam, what we need to do during it and after it. So we're going to go through all of that, hopefully. In advance, when I say in advance, I mean obviously sort of starting from a few months ago when you've actually decided, yes, I'm going to do the PLAB. You've passed the English language test, you've passed the PLAB 1, and you are now preparing for the PLAB 2. Preparation wise, there's loads and loads we can talk about. Obviously, there's a whole wealth of information, and obviously in the course we cover all of that, but just generally it's about how to approach the stations, practice, practice, practice. There's the PLAB blueprint, which gives you all the guidance about what is covered in the PLAB, and there's so many other resources which we can talk about later on. Sorting out things like your visas, your passport, making sure everything's in order, nothing's expired, making sure that you have a good timeline of, when, be realistic about when you're applying for your PLAB to make sure you leave enough time to apply for all of these things, and, so that you're not stuck later and having to cancel it and rebook. Making sure about obviously funding, that you have enough for your stay there, for your accommodation, make sure all this is sorted out well in advance. Okay. And then sort of week or so before, and I assume that most people would have already traveled to the UK if they are not already in the UK. Make sure your clothing, I know, and so it's silly and it sounds a bit petty putting clothing there, but really clothing is a big one because people really, panic about, oh my God, I haven't thought about what I'm going to wear. So make sure you get these things out of the way well before. Things like travel routes, timings, make sure you might even have done a, visit before, just to make sure you're not leaving any last minute stress. Also in the kind of run up to your exam, just make sure you really look after yourselves. Pay attention to things like your sleep, your food, exercise, looking after your stress. Just it's no good trying to kind of, study 20 hours a day and just surviving on minimal sleep, because by the time you get to the exam, you're just going to be burnt out and not be at your best to be able to perform the way you need to. Okay. So be mindful of all of these things and start working on them before. And then the day before, obviously, just make sure you go through everything, your checklist. Just make a checklist so that you can just tick it off on the day. Make sure your ID document, that's extremely important. If you forget your ID document, you're going to be really stuck. Again, make sure you find your clothes, everything's ready, any essentials, that you need for your journey. Make sure if it's a busy time of the morning, make sure you've accounted for rush hour traffic, booking your taxis or whatever in advance. Just checking all of those things, really. There's no strikes or anything. So that's before your exam. And then if we move on to on the day when you arrive, as you might know, there's two centers with very similar names, 3 Hardman Square, 3 Hardman Street. Please make sure you go to the right one. You will usually get an email from GMC explaining clearly where you need to go, what time you need to be there. So just really try and plan things super well. Don't assume you have plenty of time. Things do happen, so just make sure you leave enough time. If you're late, you will not be allowed to take the exam. You cannot, they just won't. You'll have to reschedule. So if you're early, they might not let you in the building, or they might ask you to wait outside until it's time to let you in. But please, it's better to be early than to be late. Make sure you have your proof of photo ID. Usually it's a passport because most people are international, but if you have the European ID card or your UK driving license and things, those are acceptable as well. But it'll usually be a passport for the international medical graduates. During, at the beginning, when they're registering you, obviously they check your name off, check your ID. They will keep your ID till the end. So, it's in safe hands while you are doing your exam. They'll take a picture, give you an ID badge, and you wear that throughout your exam. You don't need to bring any equipment. This is something people panic about, like, what if I needed to take something? No, just don't worry about it. Apart from the passport, you really don't need much at all. They will provide everything in the room, any instruments, any BNFs, anything at all you need will be there. If you do end up taking extra things, you'll just have to put them in the locker. Be very careful that you don't take any well, obviously, if you will have your phones and things, but they will all have to be secured in the locker. You're not even allowed watches. So anything extra will have to be secured in the locker outside before you go in. So when you're going in for the exam, you literally just have your ID badge on, and that's it. I've put here a link, what to expect on the day. A lot of this information is available on the GMC website. So, this is all authentic stuff. You can obviously have a further read through. They have a video as well. I'll be happy to share the link later on. I'll ask the admin to share the link in the group for you to take through. But because we don't have much time today, I'm not going to go through it. It's about a 10-minute video. Okay. Right, now we come to the actual exam. Again, many of you already know about this, but just for those who don't, just to orient them a little bit. So the PLAB 2 has 16 stations which are active, where you actually have to perform. And then they've been kind enough to give you 2 rest stations. So you can have a little breather, have a little drink and some biscuits, or go to the toilet, as many people need to. Where you get the rest stations is, you can't really predict. It all depends on where you are in the circuit, but they are sort of in the middle of your circuit. So if you're really unlucky and you start with the rest station, then you're only going to have one in the middle. So, but it's okay. It all works out in the end. You will have your task or your instructions and the patient information outside your room. We will talk more about this later on. So we'll discuss one of these. And it's there for you to read. You have either 1 minute 30 seconds or 1 minute 45 seconds, depending on which center you're in. And you have that much time to read the task. It's not just to read, but it's also to move between stations. So one of them is a bit longer than the other, so it takes a little bit more time. Hence the increase in 15 seconds. There will be timers very clearly sounding, so there's no question about the fact that you know exactly when the timer goes and you need to enter the room. Once you enter the room, you then have 8 minutes from the time you enter till the time you complete the task. They will sound a 2-minute timer, so 2 minutes before the station's completing, they will say they have 2 minutes left. So it's a really good way of kind of really speeding things along if you haven't yet managed to get to, for example, your management or something. As soon as the timer goes, you have to leave, get up and move to the next station. This way, you're going through all 18 stations, and the exam takes roughly around 3 hours to complete. Okay. I know that sounds like a lot, but when you're actually there, it's just a whirl. So yeah. As we said before, you'll have access to the drinks and biscuits in your rest station as well. Right. Now, during the exam, what actually happens in that room? You have scenarios. So as you know, you'll have your task outside the room. Inside, you could have anything. So it could be a mannequin only, where there's no actual patient or simulator or an actor who you have to speak to. There's just the examiner and the mannequin. There might be equipment such as a telephone, or there might be a BNF if it's a prescription. There'll be a Cardex. But usually you do have an actor who's playing the part of a patient who you will be interacting with. Sometimes you have both. So you could have like a combined station where you have an actor plus a mannequin. You will be assessed in every single scenario by an examiner. So this could be in person, by telephone, or even distantly. In some cases, there are any examiners in the room. For example, sometimes prescriptions, but they are observing you and they are assessing you. Examiners will not usually interact with you. This is a bit of a funny thing, because I've heard from some students that they are told sometimes in the task that the examiner will ask you for the diagnosis, or the examiner will ask you to explain. That will not happen. The only times they do interact with you is if, for example, you say that you would do some investigations or some examinations, then they will quietly hand you a card with the results on it for you to interpret. Sometimes in the simulated mannequin station, the SimMan or the METI station, they can sometimes talk to you a little bit more. And that's usually to clarify what you're doing. So for example, because of the nature of the station, the way it runs, you might have to say, oh, I'm going to give them some IV fluids. at which point they might ask you, doctor, which IV fluids would you give? And then you'd say, oh, 500 mils normal saline or Hartmann's or whatever. Just say, I'll give them oxygen. They might ask you to clarify what mask would you use or how much oxygen. They might just ask you that sort of thing again, just to be clear. If you just say, I'm going to give them adrenaline, they might say, okay, what dose and what route? So it's just those kind of things that they might ask you. Just again, that's in your best interest. It's not a negative. It's just so that they're clear about what exactly you're doing. But otherwise, you shouldn't really expect any interaction from examiners. People sometimes are confused whether the same cases are running in both centers. The answer is no. Hardman Square and Hardman Street are both independent. They have different cases on the same day. So, candidates will have a different set of questions and everything. So they're not the same. You're not supposed to talk to the other candidates. You're not supposed to copy or write down any details about the exam, not discuss these. That's something GMC asks you to sign to, and you need to adhere to that. Right. So now you're done with all your stations. What happens next after the exam? You can take a breather for 4 weeks, enjoy and relax, or then stress about how miserably you did. Hopefully not, but yes, that usually happens. Those 4 weeks are very, very difficult for unwinding, really. There's always this nagging at the back of your mind. But usually it's around 4 week mark, and you get an email and you can access the GMC website as well to check your results. We will talk a little bit more about the score sheets and the actual result sheet, but essentially they tell you how many stations you passed and what your overall score was, and they also tell you what the overall passing mark was. So you find out whether you passed or failed. They also break up the individual stations marks for you, and they tell you if you've passed or failed individually as well. There's also then a table showing the skill areas you were weak in. We will discuss these more in a bit when we get to it. People sometimes ask about, oh, can I do an attachment or not, or can I start applying for jobs or not after the PLAB 2? So you have to wait. You have to have passed the PLAB 2, and once you've applied, you've registered with a full license to practice with the GMC, you're eligible to start working. You can, however, undertake clinical attachments even before the PLAB 2. So there's no restriction on when you do the attachment. You don't have to have passed the PLAB 2 to do attachment. So that's a little question I thought I'd answer because I do get asked this often.